Welcome to Brain Tumor Talk, a podcast brought to you by the Ivy Brain Tumor Center at Barrow Neurological Institute. This show unites leading experts, inspiring survivors, and compassionate caregivers in conversations about the latest in research and treatment. Together, we share stories filled with challenges and hope. I am your host, Michelle Palacino, a member of the Ivy Center team. My deep understanding of brain cancer comes from both my professional insights and personal experience as the daughter of a brain cancer patient. Brain Tumor Talk is your invitation to connect, learn, and find support in this community. The information shared on this podcast is for educational and informational purposes only. Nothing stated on this podcast should be considered medical advice. Welcome to Brain Tumor Talk. I'm your host, Michelle Palacino. Today's guest is nothing short of a legend in the world of neurosurgery. Dr. Robert F. Spetzler, renowned for his pioneering work in vascular neurosurgery, has tackled some of the most complex and high-risk brain surgeries ever performed. With over 6,000 aneurysm clippings to his name and the development of groundbreaking techniques like the cardiac standstill and the Spetzler-Martin grading system, he has redefined what's possible in brain surgery. He is the only two-time recipient of the most prestigious recognition in neurosurgery, the honored guest of the Congress of Neurological Surgeons. As the former president and CEO of the Barrow Neurological Institute, he's mentored countless neurosurgeons, leaving a lasting legacy in the field. We're honored to have him on today to share his stories from his incredible career and insights into the future of neurosurgery. Dr. Spetzler, thank you so much for joining us today.
Thank you, Michelle, for that overly kind introduction.
I don't think we could overstate how much you've really impacted this field. It is really incredible. I know we were talking about this. I've done a lot of research in the past few months, really, just to even dive in and get a spoonful of what you've...
I appreciate that, but in many ways, I'm sort of the recipient of the intelligence, commitment of people around me. Mm-hmm. If I have one particularly good talent, it's to delegate. And when I delegate, I get a lot of the benefit of whatever my delegates have success in.
Yeah. I have to ask you, how did you get started in the field of neurosurgery?
You know, I was very, very early in my decision to become a neurosurgeon. When I was a freshman in high school, in my yearbook where it asks for what do you want to be, I already put in neurosurgery. I think it had to do with an event when I was 6 years old. I stepped on a rusty nail, and that developed into tetanus. And when you have tetanus, and this was back in post-war Germany, it's a debilitating disease where you have big spasms, like seizures. Mm-hmm. And I was diagnosed fairly late. And so in the middle of the night, my parents put me in the anteroom to their bedroom chamber because I wasn't doing well. I was one of 6 kids. And I broke an old family vase in one of these attacks. And then I expected some form of punishment when my mother came in, and instead she hugged me. And in the middle of the night, they drove me to the university hospital. Mm-hmm. My dad kept telling me stories because as soon as I drifted off, I would go into these tetany attacks. And I was brought to the university hospital in the middle of the night, and I remember these white coats standing around, and then they burned out, they cauterized the little sore that I had in my toe. And because I was so far along, they didn't want to put me in the pediatric ward because they know I wouldn't survive. So they put me in a storage chambers of the big iron lung machines. This was back in the days when iron lung machines kept people alive from polio when their respiratory systems were paralyzed. So they had these incredibly huge machines. Me, little 6-year-old, with these huge machines in the storage room, oval window, my mother crying outside saying, if he's going to die, let me take him home. Mm-hmm. But they gave me what was then a relatively new drug called penicillin. Mm-hmm. It killed the bug, and then I spent, maybe 2 months in the hospital. Mm-hmm. And one last important event was the physician that took care of me, the professor, was obviously very proud of that. He had a case of certain fatality, survived because of penicillin, so they presented me as a case in front for rounds. So in my 6-year-old eyes, I was placed on a little table on the stage, and I looked out at the sea of white coats. And then the professor took my robe off. I was standing there completely naked, 6 years old, so that he could demonstrate the reflexes. To this day, I still feel the embarrassment I feel then. And I hope that in some way it gave me maybe a little more empathy for my patients, because we're always rushed, we don't have enough time, etc. And so,
everyone always says that, or a lot of people who get into this field always say that they're brought into the field or they had an incredible mentor and they see these physicians as sort of godlike, really indestructible, and that's kind of how they got swept into the field. Would you say that this physician was the reason that you decided to get into the field, or was it just the whole experience?
No, I think I don't really know why I chose neurosurgery, but I'm sure because none of my family had been in medicine. They've been engineers, they've been educators, they've been scientists, but not into medicine. His having me on that little table, I had no personal relationship to him at the age of 6. So he was not a hero to me. He was a cause of my incredible
trauma,
memory of embarrassment. But then when I went, since I knew I wanted to be a neurosurgeon in high school, I did research in college, and then I did research in medical school, and I went to medical school where there was a professor named Dr. Busey who was the most eminent neurosurgeon in the country at the time, and he took me under his wing, and that's sort of how things progressed.
Yeah. I've heard that the phrase, like, you've opened up no man's land, and you came to Barrow and really, it did not have the reputation that it does today. You really made it a world-renowned institution. And so I have to ask, like, what brought you to Barrow Neurological Institute?
Yeah. So I was interviewing for a chairmanship position in New York. I was offered the position, and I was in negotiation with the dean of the university. But it didn't feel right. They never asked my wife to come and see the place. And then Dr. Green, who was my predecessor here, had formed a search committee to find his replacement. And it had the prerequisites for me of something to look at, and that is it had a residency program. And that was very important because I wanted to be involved in teaching resident. I was at Case Western at the time. So when he met me at a meeting and said, please come and look, he insisted that on the very first trip, my wife Nancy come out with me. Well, when she heard that I was going to interview in Phoenix, she said, well, if you go to Phoenix, you're going without me. Because she remembered driving through Phoenix in the middle of July in an unair-conditioned car. So, but when John insisted we come out together, and it was in the fall, it couldn't have been nicer. And we've loved Phoenix ever since. And it was the challenge. This was a very small program, but I like challenges, so it was perfect for me.
I think that a lot of people are familiar with your name, and then also in partnership with you is Dr. Volker Sonntag, who is a legend in his own right, and he's obviously been a significant part of your journey and a significant part of the Barrow journey. You guys come from a similar upbringing, parallel career paths. How did your partnership with Dr. Sonntag influence your approach to neurosurgery? And how is kind of your collaboration together?
Yeah, well, Michelle, when I came, I was introduced to Dr. Sonntag by Dr. Green. Volker Sonntag was in private practice in Phoenix. There was an immediate bond between not just Volker and myself, but also between our wives. So we became friends. So I asked him to join the group that I was establishing for the BNI, and that group's goal was subspecialization. That meant within neurosurgery, you had to pick an area that you were going to be improving. You were going to be at the cutting edge. You're going to push the envelope. And he ended up doing spine, and he became the most recognized spine surgeon internationally. And he bought into the vision that we then shared with resident education and research, etc. And he was an absolutely invaluable partner in achieving the prominence of the BNI that it holds today. But it wasn't just Volker, it was a whole team of individuals. Joseph Bramsky was in my lab at Case Western. He came with me to Phoenix when I came. But there were a whole number of individuals that all came together and bought into the vision of making the BNI really what it became.
You just mentioned the subspecialization. You are a huge part of the residency training program here, and I know that there is a huge focus on subspecialization. Can you talk about why you think it's so important for neurosurgeons to really have this?
It's very simple. If you are a generalist and do everything, you will never acquire the number of cases in one category that allow you to call yourself an expert. Subspecialization gives you the experience of seeing a problem over and over again enough so you can begin to look for options of improving the care of that particular problem. And that's what subspecialization is all about. So we pushed subspecialization very hard. We also pushed to get the very best residents, because a program is only as good as its residents. And so we worked very hard to get the very best residents, and we ended up having our pick of the many, many, many hundreds of applicants that applied for the 4 positions a year. They've been absolutely spectacular.
Well, I have to say, while we're talking about residents and mentorship, your former fellows and residents have described you as the consummate teacher, and you've been instrumental in the resident training program. What is the most important lesson that you hope that your trainees or even our residents are carrying with them?
Yeah, I should say that I've had the opportunity to train over 200 residents and fellows, but I've also had countless international visitors that have spent a international fellowship here, a year, 2 years, 3 months, 6 months, etc. And they are my professional children. I'm incredibly proud of them. What I wanted from them is the one ingredient that I think is essential to be a good neurosurgeon, and that is passion. Passion for this specialty. You have to give it everything you've got. You owe that to your patients. And so these individuals that commit themselves to this specialty don't just have the passion, but it comes along with empathy, comes along with understanding the incredible trauma that patients and their families face when they suddenly find out that they have a ruptured aneurysm or a tumor or whatever else they're facing.
This leads me to my next question, which is kind of about broadening your horizon. Your brother shared a story about how you used to quiz residents on music and culture and current events during your rounds. And he mentions that this was about emphasizing the importance of broadening kind of a surgeon's horizons and alluding to the fact that you can't really empathize with patients unless your horizon is widened. Where did this philosophy come from? Was it from that original penicillin experience where you...
No, it didn't have to do with that. I grew up in a household where my father had broad interests. He played chess with me. We listened to classical music together. I learned how to play the piano. And so there was much more to life than just his profession. And so I grew up in a household where we had discussions every evening at dinner. And I wanted our residents to be broad.
Mm-hmm.
They, as a physician, they were going to be important members of their society, and they shouldn't just be narrowed into being a physician, but also be broad-minded, whether it's politics, religion, arts,
Mm-hmm.
whatever you pick up, so that they have something outside of medicine.
Right. You have operated, you've done thousands of cases. How have you maintained that empathy with and a connection to each and every one of these cases?
That was not hard. Each patient, when you see them, presents a new challenge.
Mm-hmm.
How are you going to help them? And when you have a positive impact on a patient, it is an incredibly gratifying experience. More devastating is when you fail,
Mm-hmm.
whether it's something like a malignant brain tumor that you can't cure, you can just help maintain, and you try for extended quality of life, but you know that the patient is going to succumb to the disease, and so on down the line. And so the failures really what stick with you. Every neurosurgeon has their sort of like a graveyard
Mm-hmm.
where the bad cases reside. So whenever you have a success, it's always balanced by the fact that you remember the last case that you weren't able to help.
Mm-hmm. This, I was just thinking about, so you've done really, really complex, some of the most high-risk vascular surgeries. But I think what a lot of people don't know is that you're also an extremely prolific brain tumor surgeon as well. And you've taken on cases that many have deemed inoperable or impossible. What made you gravitate towards those cases?
Michelle, that's a very good question, and the answer is straightforward. As a vascular neurosurgeon, you deal with blood vessels all the time.
Mm-hmm.
The biggest risk with tumor surgery are blood vessels. Mm-hmm. So the vascular surgeon who becomes a tumor surgeon or does both right from the beginning has a distinct advantage because you can do things like take a blood vessel from the outside of the head and anastomose it to a blood vessel in the inside of the head because the tumor has eroded the primary blood vessel. And so those sort of skills are not usually inherent in somebody that is just doing tumor surgery in the beginning. So the advantage for a skull-based tumor surgeon to also be a vascular surgeon is immense.
So while we're on this subject, and alluding to your last answer, you mentioned the graveyard of cases. Can you talk about a particularly challenging case that you remember that sticks with you?
Oh, I remember many cases. There's an entity called an AVM, which is a tangle of blood vessels,
Mm-hmm.
which they're very fragile and they can explode. And one particular case, very early on in my career, was a very, very tough one. I had already received quite a bit of reputation for tackling these particular entities, AVMs, that I worked hours and hours on getting this out successfully. Very pleased afterwards, and then I get a call at 2:00 at night, and these are always dreadful calls, happen way too frequently, that the patient had suddenly become comatose. He was fine after surgery, comatose. And so in this bed where you had taken out this tangle of blood vessels, there are a lot of raw, coagulated vessels that had been controlled, and one of them ruptured,
Mm-hmm.
caused a huge hematoma, blood clot, that ended up just devastating this young man.
How do you maintain any kind of optimism or not get hung up on questioning the where did this go wrong with all of them?
Well, I think when you operate, there will always be complications. It just, they don't happen very frequently, but when they do, they can be as devastating as that one, or they can be minor. And so we have something called Morbidity and Mortality Conference, where we present all complications. What is the most important aspect of a complication is that we dissect it. We don't point fingers, but we look at how can this be avoided? How can we take this tough lesson and benefit the next patient that has a similar problem?
So we're looking at the complications and the negatives, but to shine a brighter light, looking back at your career, you've had many, many accomplishments and you've advanced the field. And looking back, what's the highlight? I mean, I was reading this story about a boy, Enrico, who was a 4-year-old boy, that surgery was miraculous. But over the span of your career, what would you say would be the highlight?
I don't think you can point it to one individual patient. I think the fact that we developed access routes to portions of the brain that had never before been considered, sort of a no man's land. If you go there, you're going to hurt the patient irreversibly. There's a structure called a brain stem, where all the function of the brain pass through a bundle in the brain stem that's no bigger than your thumb. And so when there's a problem in that thumb, it was considered impossible to treat this. And with new diagnostics, with new imaging modalities, etc., we were able to define those areas, and then we found routes to get there. Wasn't just us, but many of our colleagues around the world that worked on this. And so we opened up pathways and were able to help people that beforehand we would just have had said, I'm sorry, there's nothing that we can do.
Do you think that when you're looking at the residents and trainees, that this visionary attitude, this grit, determination is something that you can teach? Or is it something that you have to identify in the people that are coming through and select them carefully?
Michelle, very well done, yes. I think for somebody to want to enter this field, which is a field that requires a willingness to always say yes when you're called, when somebody's in trouble. That creates a big burden on your family, and so they have to buy into this. They already have that grit that you're talking about. What I think is most important is that not only do they have the passion and dedication, but they also are enough of a mensch, enough of a human being to show the empathy to their patients and families that is required. It's very tough because surgery takes up so much of your time. Then you have research, then you have teaching, and then you see your patients. All of that has to be squeezed in. And so you never really have the amount of time for your patients that you would like to have, to sit down and get to know them better, etc. It's always rushed. So it's important during that rush to let them know that my job is really when you're in the operating room. That's when I take all the time that is required. I'm sorry I only have so little time, but I understand your problem and this is what I recommend.
Right. You just kind of touched on it. The balance between family and this career, it's a precarious balance. I have a quote of you saying that the secret to success is having passion in what you do, and if you're happy at home, you're happy at work. And a lot of our residents are starting families and they are trying to find this balance. How did you balance the demands of this job with happiness in your personal life?
Well, I met my wife in the hospital. She was a nurse student, and she was taking care of a patient with a brainstem glioma. So that we talked about the brainstem before. This young man was dying. There was absolutely no hope for him. That's the only patient she took care of, and she needed an order for more fluids, more hydration. So she paged the person that had written the last order, which happened to be me. I was a medical student. So she paged me out of rounds, and I came to the thing, and I stood before her, and she gave me every fact. She just kept talking, just one thing after the other. Finally, she ran out of every electrolyte value that she could possibly come up with. And she said, well, what do you think?
Yeah.
And I said, you have the most beautiful eyes of anybody I've ever seen. She went home for lunch to her student friends that shared the apartment and said, I found the man I was going to marry, so I didn't have a chance. Now, the reason for that story is she came and became a oncology nurse. And when we went to San Francisco, she worked for a very famous brain tumor institute, Dr. Charlie Wilson, and she was his neuro-oncology nurse. The advantage of that was she knew what the specialty was all about. She knew the burden of a call from a patient because she did them for her patients, the brain tumor patients, which require a great deal of empathy as they struggle with their disease. So I had the distinct advantage of somebody that knew what was going on and never gave me grief if I couldn't make Christmas or a New Year's Eve party or any sort of social event. So we had a terrific run.
Yeah. It sounds like confidence has been something that you've had since the get-go, even with this story where you're complimenting her eyes and you're surrounded by people who are at the top of their field. You've been described as being legendary. How do you stay grounded?
Well, in order to be grounded, you have to be off the ground in the first place, right?
Right.
I don't think I've ever been off ground. I know when I look in the mirror who I am. I'm one of 6 children from my parents. I know I have my failings, and I've never let my success get in the way of realizing that an incredible portion of my success is due to the people that have surrounded me. Even at home, my wife, socially and raising money, etc. All of these is really dependent on other people. So I've gotten a lot of benefit, but when I look in the mirror, I know that. So that certainly keeps me on the ground.
Keeps you humble. So I want to, we've kind of looked at your past and looked at your mentorship and things like that. And we've talked about, you just kind of touched on your successes. So you've built this brain tumor program here, and you recruited Dr. Bill Shapiro from Sloan Kettering as the chief of neuro-oncology in 1989. Are you surprised in how the field has evolved over the years? And did you envision a program like the Ivy Center at Barrow's future?
Well, let's take one step at a time. Bill Shapiro, I met when I was giving a talk. I believe it was in Japan, and he was also there from Sloan Kettering. And I was very impressed with his presentation. His wife was a researcher in neuro-oncology, brain tumors. And so I needed a strong chief of neurology, and I offered him the job, and he wasn't able to accept it at the moment. And then he called me back maybe a year later or something. He said, if you still need me, things have changed personally in such a way that he thought maybe he needs to come back.
Yeah.
And so I got him, and he built the neuro-oncology program. The Ivy Center is something really that's totally separate. That came much later. And I got to know Catherine very early on, a charming, committed individual whose tragic story with her husband really led her to dedicate the focus of her life and of her resources toward finding a cure for glioblastomas. And I think she's universally admired for her focus and what she has achieved.
Yeah, I think she's changing the way philanthropy, for sure, and also the way that research is being conducted and how institutions are running their programs. But to kind of reflect, take a moment of reflection, you know, you've built this incredible program here at Barrow. Is there anything you would do differently looking back?
Oh, yeah, a lot of things. In retrospect, mistakes I would have avoided, but the retrospectoscope is never something that I spend a lot of time on.
Yeah.
Because you can't change that.
Right.
But overall, I've obviously been incredibly gratified with the way the BNI has grown, the large additions of personnel that have added to its reputation. So, yeah. Not interested in the retrospectoscope.
Well, we talk about you being a visionary. So, you know, looking forward, what excites you the most about the field?
Neurosurgery or neuro-oncology?
Both.
Both. Well, in neuro-oncology, one of my fellows who came from San Francisco, from an environment where brain tumor was really a focus of the Institute for research as well as treatment. Nader and I spent a year with me, and his aptitude was very quickly recognized. And when he finished, he had the options of going to a whole number of programs, the majority offering more lucrative contracts than the one I offered him. But he chose to stay. And so the intersection of Nader and I taking on research in brain tumors, bringing in individuals with great research aptitude, really formed a team. And then with the incredible coalescence between he and Catherine to build the Ivy Center as it exists today, that's just, I mean, that was never within my vision.
Right.
But it's a great example of giving somebody that has a lot of talent the reins to control their own destiny.
So was that was neuro-oncology. Now what about neurosurgery?
Well, neurosurgery, it's such an incredibly dispersed field. You can spend all of your time taking care of complex spine problems. On the other hand, you can go all the way over here and put electrodes into the brain, into people that are paralyzed, and using computer interface to allow them to move their arms, etc. You have radiation in between. There are so many different fields, all of which are progressing, which goes right back to what we started with. Why are they progressing? It's because of subspecialization. They are concentrating on this narrow field of neurosurgery, and they're pushing the envelope.
Yeah, and perfecting.
And we are in the in the stone age of many of these endeavors, like implants into the brain.
Mm-hmm.
It is well within my lifetime that Benabid, a neurosurgeon in France, Switzerland, developed the first stimulator that goes into the brain that helped Parkinson's patients. And now we are the largest, I believe we are still the largest center of implanting these electrodes with Dr. Ponce. Made a huge difference. But that field has exploded so far beyond Parkinson's disease. And you have things like Neuroplex, with Musk supporting a new industry. And he sees the value of that, and first patients that have been done here. This is all part of the incredible advances within this field, and it's just galloping along.
Yeah. So I'm going to end this podcast with one last question, and then we normally typically do kind of a rapid fire of just a few couple personal questions. But you've obviously left an indelible mark on neurosurgery and neuro-oncology, and honestly on patients and caregivers and families. There are people who are out there who think about you all the time. Like you're the conversation at families' dinner tables about how you've saved so-and-so's life. So what piece of advice would you give to, this is a two-part question, to patients and caregivers, and then what would you give to young residents who are just starting their careers?
Well, to patients and caregivers, first, it would be very important to give due credit to the real workers in this field. In the hospitals, it's the nurses, the technicians, etc. They carry the weight. They do the daily interaction. They do the heavy lifting. And when they leave the hospital, whether it's in rehabilitation or at home, and then you have the family support that is so critical for their loved ones that are in peril. And I think there is no specific advice because everybody is different. The situations are different. The degree of deficit is different. What you do get to experience is you get to see some of the greatest parts of a human being, the empathy, the mother that takes care of her invalid son or daughter, the love shown by the support group. It brings tears to your eyes. Your job, I think, is to let them know that you recognize how hard it is for them, and that you want to put them in contact, for example, a social worker that can help facilitate the kind of support that the state provides, the government provides, or other sections provide. For the resident, the advice is don't ever forget the empathy. Think of what this patient is going through as one of your loved ones. And when you do that, you'll have the appropriate empathy and provide them with the best that you can give.
Well, that's great advice. So thank you, Dr. Spetzler, for joining us on today's episode and for all of your insights and for everything you've done for the field in general. It's really incredible, and I'm honored to be here today. It's just talking to you. But we always end these episodes with a rapid fire, and the theme is that we often hear this phrase, 1 day at a time, 1 week at a time, 1 minute at a time. So I'm going to ask you, what's your one thing or idea or choice that holds significance to you in the following questions? So what's one piece of advice you would give to your younger self?
Be even more empathetic to those in need.
What's one thing people would be surprised to learn about you?
I think that's a very personal question, and I'm not sure. I balance my neurosurgery with a lot of physical activities, skiing, hiking, just like in neurosurgery, I sort of push the envelope. I do the same thing. For example, I did a 207-mile bike race, which over 3 mountain passes from Logan, Utah to Jacksonville, Wyoming, the longest sanctioned bike race in the world. And I won my age group twice. So I'm more proud of that than virtually anything else.
This is a fierce competitive nature.
Yeah, and that is the translation, right?
Yeah.
In neurosurgery, you have to be competitive because you have to get there. And the same thing with physical activity. So that's sort of my balance.
What's one thing you do to de-stress?
That is what I do to get rid of stress.
What's one habit you'd like to break?
What's one habit I would like to break? And it shouldn't include like doing podcasts with it.
Yeah, I know. No. That's my habit.
I see. There are so many things I'd like to shake. I don't have a specific one.
What's one book you'd recommend everyone reads?
Oh, I love to read. We have a whole group of individuals, like my brother, was in a biking accident. He and I did this race that I mentioned together, and then 3 months later, he was in a biking accident, became a quadriplegic. He was a orthopedic surgeon, but he's one of the members who loves to read, and so we exchange books all the time. But I have a whole group like Dr. Barrow at Emory and so on. There are so many books. Team Arrivals is one of those books about Lincoln that I absolutely love. The Making of the Atomic Bomb is another book. It reads like a novel, but it brings so much history to life.
Yeah. What's one thing you're most proud of?
My residents and my family.
This one might not be applicable to you, but if you weren't a neurosurgeon, what's one profession you'd want to try? Knowing that you've wanted to do this since high school.
Yeah.
There's nothing.
I'm afraid I'm one of, that's why I always considered a neurosurgeon that loves this field doesn't really work. The real workers are the ones that are in assembly line, the miners that go down into the shafts, who live only for the break that they get and the time for the shift to be done. Whereas there's never been a day in neurosurgery that I haven't loved coming to work.
Man, what a blessing. Okay, last one. What's one thing you'd like to be remembered for?
My progeny, my residents and my fellows, and that they and I gave the best we could for our patients.
Well, thank you so much.
You're welcome.
I really appreciate it. Thank you so much for being on here today. We hope this episode has informed and inspired you. Subscribe to Brain Tumor Talk so you don't miss another episode, and please consider leaving us a review to help others in the brain tumor community find us.